All of the treatments we offer here are very safe, and we do a very careful risk stratification of each patient to keep you as safe as possible. So the one that comes to mind probably for most people would be a blood clot. And so we do stratify you according to your other medical issues and your age and the state of things. And sometimes, if necessary, I will prescribe a short-acting, low-dose blood thinner to take for a week after the treatment, just to keep you very safe. This also happens in patients who live far away, because we consider prolonged sitting, so 4 hours or more, where you're stuck in a seat belt. So it could be a plane, it could be a train, it could be a car, but if you're stuck for 4 hours sitting, sometimes we'll also give you a blood thinner for that. So that's probably the main risk that people worry about. The risks are less than 1 in 1,000 in general, and I think even lower because we're careful with prescribing blood thinners as we need to. But the more regular complications or risks would be some discomfort afterwards that can be easily managed with anti-inflammatories and wearing your stockings, your compression stockings. Bruising is going to happen. Normal bruising takes about 10 days to go away. If you do end up with a bit of hyperpigmentation, which is a bit of a brown discoloration that some will mistakenly call bruising, that can take sometimes 2 years to fade. So that is impetus to stay on top of your veins, because the more surface showing veins that you have, the more green and dark blue, purpley veins that you've got, there's more risk of hyperpigmentation. So the sooner you get on it, the better. But if it's well treated, that usually isn't permanent. And that's where we just want to stay on top of this, prune that tree so that you have minimal hyperpigmentation. So seeing results, some of them will be almost immediate. Some of them, the veins will look a little bit worse before they look better. But this is a patient's journey, because some of these will take a year to fade, sometimes longer. Sometimes if there's a pressure point underneath, it can make the appearance take longer to resolve. And sometimes we need to ultrasound again to see if something has opened up underneath, and then we can treat that. And generally though, these veins are going to go away. The smaller spider veins can go away right away, again, unless there's some sort of pressure underneath. The bigger veins, you'll notice improvement almost immediately, but it can take up to a whole year for some of the bigger ones to fade. It just depends. Your body will do a beautiful job once they're treated, but it can be quite slow depending on how big the varicose veins were to begin with. So as far as your symptoms go, the heavy, tired, aching, throbbing, itching, burning, swelling, cramping, restless feeling in your legs, and you may or may not have symptoms. You may just be being proactive and trying to prevent them. You may have had symptoms and then they've gone away, which is not a great sign actually. But all of those things, you'll notice immediate resolution of those, not completely, but you'll notice improvement almost right away. As far as the symptom that takes the longest to see disappear, it's probably swelling. That might be more of a sign than a symptom, but if you have some swelling, sometimes it's going to get worse before it gets better. But this is all normal. But we want you to please call, please come in if you're worried about anything, and we always are happy to assess you with the ultrasound and make sure everything's going well. So you're probably wondering about the timing of these treatments and when can I go back to skiing, when can I fly over to Europe, all of that kind of thing. So because the procedures are elective, meaning that you're choosing when to do them, you choose it when it's the best time in your lifestyle, your schedule to do it. So you don't get your veins done and then fly to Europe the next week. If you're gonna have one of the bigger catheter-based procedures like the thermals, the laser, the radiofrequency, or the glue, or the tumescent sclerotherapy, we want probably a good month between having the treatment and then having prolonged sitting. And that's just to keep you as safe as possible and also to minimize your worry. As far as weightlifting goes, again, skiing and all of that, right after you've had your treatment, we don't want you doing anything that is really, really intense, because we don't need what we would call like a fever in your legs. So you don't want to encourage inflammation, because we don't want to put inflammation from rigorous activity together with the slight inflammation that you may get after the treatment. We don't want both of those things together. So just plan it that you're going to tone down on your really heavy exercise, but we want you active. So you can maybe do lighter weights for a month. You can do rigorous walking for a month, 2 weeks to a month. Just tone it down a bit right at the beginning, but you're back to regular activities almost immediately right after the small vein sclerotherapy. So it is pretty non-invasive in your life to have your veins treated. So you might be wondering, Are these veins going to come back? Do I have to keep doing this? And it really is kind of like going to the dentist. Do you think that once you've had your teeth cleaned, once you're good for life? It's not like that, because we haven't changed your genetics. We haven't changed the fact that you're aging. And so if we can help you maintain this, so see you regularly. Some people might need to be seen more regularly than others. And it just depends on your anatomy and your tendencies. So we encourage being seen every 1 to 2 years, depending on how quickly you build up new veins, and expect to have treatment when you come for your reassessment. And once you're here, if you've planned it on that day and we have room in our schedule, we can actually treat you on that day. Otherwise, we can make a plan depending on how much work is needed. But it's something that you'll never be done with. There is no cure to varicose veins. It is genetics and it is aging.